I'd like to open it up to those in the room. Any questions or comments for our presenters? Start here. Yes. And if you could please introduce yourself when you ask your question, that would be fabulous.
Thank you both, and also Salgado. But my name is Nicole Brown. I'm with the Global Social Service Workforce Alliance. My question is particularly directed at Meg, and if the report looked at as an intervention and as a positive impact, if it looked at the different cadres of the workforce providing those interventions.
Yeah, I don't think that it did, which is a really good piece to learn about. I think I just learned about your organization earlier today at coffee break, so thank you. Maybe we could talk after, in between. Thank you.
Alex from the World Health Organization. A question for Judith. Have you actually found out whether the program reduces perpetration and victimization? Because I saw you had 2 data waves of...
We have baseline, yes we do, a baseline and year 1. And the hypothesis was for a 2-year dose with 80 sessions. Unit of analysis is a school and a cluster RCT. And so we will not be looking at outcome, perpetration, victimization, and mental health until we have the whole dose. It's tempting, I know, it's tempting. Reports from the field are incredible excitement from the parents, from the youth, which we frequently don't see that kind of excitement about an intervention, I think sometimes, from the headmistress, and from the district level. The intervention team has integrated themselves into community life, into community events, which usually entail a soccer ball and a soccer game, and talking about what the children have learned frequently, because the communities are separate enough that at the village level, the whole school gets the intervention, of course, not just the youth that we're following. So the uptake has been phenomenal. Will it be effective on an RCT? I would love to come back and tell you at another time.
Thank you. Jerry?
Judith, my question is for you. Thank you very much, both of you, for your presentations. They were great. We have an initiative that I've been following here called the Good Behavior Game. You may or may not know about it, but it was, I believe, done in Baltimore City schools a long time ago with 1st and 2nd grade children. And it's a team building experience, and classrooms are divided into teams. They learn to work together, and building on the first presentation, teams receive incentives when they work together and they build life skills. And we found 15 years later, I believe, in studies, that children exposed to the intervention did much better in certain measures than children who did not. So my question is, with the Right to Play program, is there an incentive structure built in? What is it? Do they learn to work better in teams, or is it just the act of playing with others that is the intervention? So I'd just like to hear a little bit more about the intervention, if you could.
Yes, and I did short the intervention for the purpose of the talk, but the intervention is 40-minute sessions based on a tested curriculum for conflict resolution, esteem building, relationships without violence. Gender equity is a major part of that. There are no incentives beyond the pleasure, the reward of being able to play, having a ball, because the schools don't have any play equipment. And to be qualified for a test school or a control school, there had to be a safe place for the children to play. Frequently that involved the community removing the goats from a couple classrooms, or removing the garbage, or both, so they could qualify for the community random draw. And everybody and everybody's relative came in for the community randomization draw of the schools. And the schools in the attention control get a water tank, because there is no potable water, there is no water at the schools. And frequently children are discharged after 2 or 3, it's that nursing talk, are released from school after 2 or 3 hours because they're dehydrated. And so they have to make the walk home for water. If they can bring water with them, that's fine, but most of them are not able to do that either. So the attention control schools get the water tank. to give them that attention. But the incentives for the children is the pure love of play. And if I could have 1 second, 20 years ago, there was an Olympian that medaled. He was from Scandinavia, and as he was listening to the television and the radio, and I'm sure his phone was on, you know how we love endorsements of cereal and everything from our Olympians. We all love them globally. He got to thinking, you know, every child should have the right to play. Because he was also turning the TV channels between the Olympics and the conflict in Eritrea. And so having some ample resources at that time, he rented 2 777s, the big jumbo jets, airplanes, you know. He rented them, and he filled them with balls. And he took them to Eritrea, and he was met by whoever people are met with when they come with foreign aid. And he came down off the plank from the plane, and he looked around and saw the flour and the oil and the foodstuffs. And he said to the greeters, he said, "Oh, I'm so regretful. I did not bring any food. I brought balls." And the greeting committee said, "Oh, you brought food for our children's spirit." Because the children were there in the displacement camps, et cetera, with nothing to do but dig in the dirt. And so I always, when I'm having a bad moment, I think about those 2 jumbo jets with the doors opening and the balls falling out. Now, I'm sure they were deflated, but regardless, that is the incentive for the children and the parents and the community and the headmasters and headmistresses in district and provincial people of incorporating this intervention, is the incentive of the children being able to play, which is something we don't think about as a privilege in this country. Thank you.
I was just wondering about the cost savings and where that goes. The monies saved, you know, from these prevention efforts, could they be put back to sustain the continuation of interventions within different countries and communities? And maybe that could be done in terms of healthcare expenditures or other ways. Have you guys thought about how to take the cost savings and reinvest it directly back in for prevention-oriented efforts?
Said, go ahead.
No, I think the assumption is that, you know, in cases like this, you know, you would continually invest in what we're learning works, because we know that you don't just break the, you know, violence has been around since the dawn of civilization. It's linked to social norms and inequity and many other complex factors, so that once you identify a series of interventions that work, that you would create a standard budget line or advocate to create a standard budget line to make sure that these happen, whether it's positive parenting, whether it's a combination of education for a targeted, you know, young women who are particularly vulnerable, like girls who are at risk of child marriage, who may need, once they marry, to continue with education but have to have special time given to them or special accommodations for education, or in the case of what we learned about the sexual exploitation of children, to combine economic strengthening capabilities with sexual education. So I think, from my perspective, I don't think we're looking at making a case for an investment to say that you prevent something and it goes away forever. I think there will always have to be a sustainability piece. I mean, I remember years ago when the, you know, when the sort of the Cold War era officially closed, we had a big conversation. I was at, on the NGO committee at UNICEF at that time. We had this big conversation about shifting resources. Where will we go with all this unspent money? And I don't know if we ever landed on anything that resulted in any kind of quantifiable outcome. You know, there were lots of conversations, lots of opinions, lots of agendas, but what you and I and all of us, I think, in this room are understanding is that some of the same issues keep resurfacing. You think you knock something off in a generation, and then it comes back again, whether it's a public health issue like polio, which was almost eradicated. Then we learned that religious leaders and others were making the case that there was an ulterior motive to the vaccine. So I think that's the hardest lesson that I've had to learn, is that we watch things cyclically. So again, that's just one perspective, Holly. There may be others who've given more thought to that, and it's a good question, but that's the best answer I can give you right now.
I could segue for a half a second. The parents and the teachers are already worried about that. what happens? How do we sustain when we don't have the coaches? And what if we can't afford it? And so they have asked to be trained, the teachers. I'm here, I'm part of the day, can I be trained to do this? So that segue of funding could go to something else if this is proven effective. Again, it's grassroots answers to grassroots questions, I think. And I appreciate there's answers at the policy, at the national level, at the local level, but I also think at the grassroots intervention site level, how can we realign funding if this is successful? So thanks for that.
Let's take 2 questions. We have Catherine and Michelle.
Thank you, and thank you to both presenters. Since this is a forum on effective public policy solutions for global violence prevention, I'm wondering if we might come up, I don't mean to chair it, Louise, come up with some practical solutions. And as I'm listening, as an outcome of this meeting, and I'm not sure besides the reports if that's possible, but as I'm listening to everybody talking about costing and then going back to Andreas, your really nice presentation, is there a way, Danielle and I were talking about this, about creating tools to make this easier. Is there a way that we could come up with a readiness check sheet, much like Chris Mickton did, Alex, you probably worked with him on that, on doing interventions, a readiness sheet for costing, like what elements you need to have in place to do costing exercise A or costing exercise B or C, since they vary by context. Because I think if we could create that tool, it might be much more, it might invite people into the process. I think a lot of governments particularly would be interested in this, and then include on it how to cost implementations and interventions, et cetera. I just think we need to be a little more savvy about translating our knowledge and in some cases intellect that's produced through all these studies into a really practical tool for government and NGO and civil society. Algorithm types of things, you know, that could be simply introduced, much like the things that you took around to the UN, Meg. I looked them up. They are really effective, and I know my people. I'm one of them. You know, I have to read quickly, and I want to see it presented nicely, and then I can use it again and engage a government that way. So I think that might be a good recommendation.
Thank you. If you could ask your question, Michelle.
Mine's not really a question. It's a follow-on to the kind of suggestion around tools, but it's also a real struggle that I'm having on this whole question of where we are in the science, where we are in the funding, and the relationship for economics. So this presentation was really on evidence to policy related to costs and economics. And so one of the things that I feel like there are so many challenges in costing this work. And I worry that by looking at, I mean, coming from a public health perspective, we've always said, okay, go to governments and tell them, what GDP are you losing every year because of HIV or because of this, or if a woman only had 2 kids instead of 4. I worry that because of the absolute multi-sector nature of violence prevention with children, that we, by being very generic around overall costs, I mean, just listening that you looked at what is the cost, you come to a number of 7 trillion, but we didn't even calculate in, for example, a social worker cadre, that we're creating, I know everybody's doing the best with what the tools that we have, but I worry that in that effort for a real big kind of policy, knock 'em dead statement, we're losing really important messages about this space that may be different. So I'm thrilled that you're going to be doing an exercise on ODA and donor investment, but I'm worried about it because let's face it, other than a couple of donors who are investing in conflict and a couple of donors who are investing in GBV, there isn't a donor out there that's really investing overtly in violence prevention. What they're investing in is an education system, but an education system that keeps kids in school that doesn't have a strong component to their curricula that really addresses violence in schools should be counted as a 0. It shouldn't be counted as an investment for prevention. Do you know what I mean? So I'm just a little concerned about how we're doing this, and what I think is missing on the other side that we really, really need, which is kind of what I appreciated about some of the work that you were doing, Judith, is to be able to go to governments and say, this is how much it's going to cost you to have a curricula about bullying in schools. This is what it's going to cost you to get, we heard today about the dearth of child psychologists or social workers, or this whole cadre of people who have no skills at all in terms of working with survivors, let alone prevention. So I just wish we could move to a stage where we were looking at how much interventions cost so that we could articulate that to governments. Because I think for violence against children, actually the human rights argument is so powerful, and I think that's part of the reason why both Together for Girls and, you know, Catherine and What Works and others have been able to get the momentum we have. We haven't needed to come in with costs. We've been able to come in and say, look at what's happening to your kids, and people are just horrified. Anyway, these are random thoughts. Please forgive me, but I wish we would look more at the cost of intervention right now, because we are so underfunded across the board. It's insane. Thanks.
So I think there are two general questions and comments, and if you would like to, the first I heard is just practical solutions, and then also realizing that one size does not fit all, and really how do we really translate this into something that's really workable and usable for violence prevention.
Well, I would just like to summarize, but I think we have to think about cost in the beginning and not at the end. Excuse me, we frequently do it at the end. Well, this worked, it's great, it was accepted, how much does it cost? And we've got to measure it along the path of implementation, beginning from all the coalition building, beginning with informing the community, beginning with the certificates and the cousins, and what it costs to do this and to get the community grassroots buy-in. I find it's much more easier to get government's buy-in than local grassroots community coalition building. Because it's easy for governments to say yes, and then they change their mind, I feel personally. But to get that community basis that we can build on, I think, and we're going to have to document how much it costs, because it's expensive. But the rewards are mighty expensive, too, if we don't do it.
Yeah, and just to say very quickly, because I think what's been said has been said very well, the issue about looking at the cost of intervention, I mean, I couldn't agree more. I mean, I think we have to look at our work in a continuum in terms of the progression that's happened in our community to get to this point, Michelle. I also think, the point was made earlier, and I'm very open to learning about this, that some of the studies that have been done that share insights on the intervention cost have been done in Northern, Europe or in North America, and don't translate necessarily well to some of the places that we need to be really looking at, which I think builds on your point about community buy-in and actually, getting down more. I think the one good thing about this 2030 environment is that it does give us another tool to address something that we've all been grappling with for decades. And getting this 16.2 in the SDGs has been for us a great milestone, because at least we have something now, which we did with the MDGs. So, it would be great to have this conversation 3 to 5 years from now, after our child-friendly accountability project is taken off from the ground, to see what we've learned that helped shape those conversations. So I will defer to saying what we can do right now by saying that's our next step. Thank you.
One more question, and then we'll...
Yes, I'm Betty Lee Davis. I'm a clinical social worker who 5 years ago became involved at the policy level in Pennsylvania, provided the clinical underpinnings for what became House Resolution 191, declaring youth violence a public health epidemic and calling for trauma-informed education. And I'm pleased to say that as of this spring, that's become law in Pennsylvania now, mandated trauma-informed education with funding. This was driven through the NAACP Education Committee and also the Trauma-Informed Education Coalition that came out of this resolution. And just to let you know something about what's being done there now, it's in the beginning stages, but it's in fact, at Cheney University now, they have just begun a teachers. It's being incorporated in the education curriculum for teachers, so that's one way that some of this can begin to be addressed by requiring that teachers be informed about what to look for, not to treat it, but what to look for, how to recognize, when to refer, and to have whole school models that support resilience, and that's an approach that's being taken there now, and we've begun going around doing workshops in some of the school districts, so it's in a beginning stage. But in the state of Pennsylvania now, it is mandated that school districts statewide be trauma-informed. And I guess since the election, we'll have to see what happens with education and privatization and hope that this kind of initiative will be able to be maintained. It's also incorporated in Obama's Every Student Succeed Act. I don't know how many here are familiar with that, but that group, as well as other representatives from around the country, carried information to that commission, and incorporated in that act are provisions for recognizing trauma in schools, and also funding. So just to make you aware of that, to look further into it, that states can apply for funding, and local districts can go to the state. Now, how that will actually work out with what funds are available, I don't know, but there is law now nationally, as well as in the state of Pennsylvania.
Thank you. This has been a very rich discussion, incredible presentation, and on a personal note, I'm always excited when there's a few shout-outs to social workers. Great. You know, I think today some of the highlights is really looking at the holistic approach calls for integrating behavioral science methodology into our work, and that successful research uptake really starts with the community and stakeholders, and costing the true value of what we might call human capital, people's time and resources, and that whether it's on the global level or the local level, that to build the case, we need to build and sustain our partnerships to build violence prevention efforts. So I want to thank you all very much for being here for this panel, and I believe we're going to take a 15-minute break. So thanks.
Thank you, Evelyn.
Thank you.